Hey everyone, did you know that your spine can heal itself even if you have a bulged or herniated disc? That's right, most people don't need surgery to fix these issues. So let's break it down. Picture your spine like a series of sturdy cushions. The discs between your vertebrae are the cushions with a firm center and a resilient outer layer. Now, a disc bulge happens when the firm center starts pushing out against the resilient outer layer. If the outer layer tears, weakens, or degenerates, the firm center can escape, creating a disc herniation. Both conditions can cause localized pain and mess with your movement. And if that bulge or herniation irritates a nearby nerve root, you might feel radicular pain shooting down your arm or leg. Ouch! But here's the great news. Multiple reputable studies show that the vast majority of people with these issues can heal with conservative therapy. We're talking about options like physical therapy, chiropractic care, and specific exercises. These therapies can help reduce inflammation, relieve pain, and strengthen your spine's supporting muscles. Over time, the disc can reabsorb and heal itself, leading to significant improvement without the need for surgery. So if you're dealing with a bulged or herniated disc, don't lose hope. Consult with a healthcare professional to explore your conservative therapy options. Your spine is more resilient than you think. Thanks for watching. Be kind to your spine and take care.